Hello to our friends and family. Welcome back to our channel. It is a Tribe Called Dhillon podcast. I'm Angie Dhillon.
And I'm Rose Dhillon.
And I'm Alvin Dhillon.
And we got a special guest back in the studio today. We have owner, medical director, and cosmetic injection specialist for Micro Medical Artistry, Director Shiv Sidhu in the house. And once again, I know you say I'm not a doctor, but endearingly, we're going to call you Dr. Shiv. So welcome back to the studio.
Welcome back.
Thank you.
Happy to be here. Thrilled.
Yeah, your glutathione episode did really well. We got a lot of DMs. People are like, what is this stuff? And thank you for bringing it to our attention. So thank you for taking the time to educate us on that subject.
Absolutely. My pleasure.
Thank you. Okay, as you know, you're familiar with this. We're going to do rock, paper, scissors for our win of the week segment. Ready, everybody?
Yep.
And you have to participate too. Here we go. We go. 1, 2, 3.
Wow.
I was trying to go for something like probably be like, no, this is the injection. Like, this is
What are the odds?
That's what happens when you do come in studio. We're all in sync with everyone's energy.
It's all that positive energy.
Yeah, here we go again.
Okay,
Ready? We'll do it one more time.
1, 2, 3. 1, 2, 3. Me.
Oh,
You
so
two
no.
tied.
No, I beat you.
Oh.
And she beats him.
Yeah, so now you two.
Yeah.
Okay. Oh, us two?
Yeah.
Okay.
Oh, shit. I didn't realize. Okay.
Okay, Alvin, you go
Alvin's.
first.
Oh, I win. So that means I get to pick who gets to go first.
Wait,
And we'll go me first.
wait, but before, I can't have you do the entire episode with your one string in and one string out.
One string kind of guy.
There you go.
There you go.
Stringy.
Do we need a stringy?
Speaking of sweaters, I actually like yours because yours is like embroidered on there and it's like a nice tone.
Very nice.
nice.
Yeah, thank you.
Yeah.
I like it.
If it said a tribe called Dhillon on there, I would ask you to borrow it.
And I love the pink color that you're rocking.
Yeah.
We could do a hoodie swap after.
Yeah, I'm down.
Okay,
I'm
Al,
down.
let's talk about your win of the week.
That's a good question because I'm thinking about it. Thinking about my win. I forgot
All right,
the win.
so your win. Yeah, Alvin.
I got caught up in the excitement.
Okay, let's go over to Rose.
Okay, so my one is that as you know, I always say like I'm active. I go for my walks. I love dancing, but I'm going to own my age. I turned 42 a few weeks ago.
Whoa,
Wait,
that's
I don't like to say 42 years old. I'm level 42 now. That's right.
Right.
I'm upping
There
my
you
level.
go.
So
Awesome.
with that also comes some other challenges, which is for women, we start losing our bone density and things start to occur as we get older. So I've joined the gym so I can start weight training and getting access to more machines that'll help me get stronger. I did it yesterday and I'm extremely sore. My body is very, very sore. My abs are hurting and my arms are hurting, but I feel great. And I know that my body, future Rose, will thank me for doing this.
That's right. That's
Amazing.
excellent.
Thank
Rose.
you.
There we go.
Thank you.
Round of applause for Rose's muscles.
Yes. Okay, Alvin, are you ready for your win or should I
I am.
go? Okay,
I'm ready.
let's go.
I was ready. No, I think I'm ready. It's actually related to the podcast. So we had our goal was for 2024 to bring on more guests like Shiv, but unfortunately there'll be other guests that don't live as close like Shiv does that can be in person, but we still want to be able to interview them. So we said, how are we going to figure this out? So I looked into different options. I said, I still want to have good camera quality. I still want to have good audio. How is this going to work? So we came to a conclusion to keep infrastructure and not be investing crazy amounts in it. We looked at, we're going to do it how they currently do the podcast for people that are remote. So it'll be remote interviews and we'll be able to use our own mic, use our own camera. So it'll be, each person will be like an attendee, like how they do in a Teams meeting. And we can all do it in our own spaces. And until we can figure out a way to get them on site, that's how we'll go about it.
Amazing.
And it'll solve the problem.
Wonderful.
Amazing. And those of you that know that follow our podcast know that the two of us don't know, Rose and I know nothing about logical, not logical, but technical stuff. We have no clue. Alvin is our resident in-house IT expert, extraordinaire, handyman, Dewey of all things. And he's our brother. And we love him to
And
bits.
believe me, it ain't easy working with these two over here. And because they're not IT, you just think in your head, this is logical.
Yeah.
No, it doesn't sound logical to everybody else.
Yeah, I agree. So thank you for doing that for us because we're really pumped for 2024.
Yeah.
We can't wait to have some of the guests. And we know some of them don't live in the same time zone as us. They don't live in the same city. So we can't wait to bring you more guests talking about some really cool stuff because today's topic is super cool. So before we get into it, let's go to Shiv. Would you like to talk about your win of the week?
My win of the week is I recently got an iPad to up my game for my Instagram, for my cosmetic business, and it's learning Procreate.
Wow.
If you get familiar with that. So
Yeah.
it's a program with pictures. You can do layers and you can do photo editing and all that. So learning a lot. I'm enjoying it. So much fun.
Excellent.
Nice.
You actually have a story about your iPad. You were telling me that you watched one of our reels where we were talking about that we love a good deal and ask for, when you go sometimes to retail stores, because Indians never pay full price for anything. So tell us about the story at the Apple store, what you did with the iPad.
So of course, Apple, there's no discounts at Apple, right? You pay premium for everything, right?
Yeah.
So we're there and Angie's with me and she's trying to get a deal from the Apple people. I'm like,
Yeah, you are.
And I'm
Yeah,
like,
she is.
I'm like, Angie, stop. Like you're just,
Wait, but back it up a bit. You didn't actually want to pay full price initially, and you asked them if there was a discount.
Yes. So that was kind of the premise of it. Anyways, at the end, I ended up getting about a $70 discount.
Yeah.
There we go.
No harm in asking.
See,
And remember, that's $70 from Apple.
Yeah.
They don't give nothing up.
I know. So
you were really happy
was
about
awesome.
that.
I was happy. So
good stuff.
thank you.
You're welcome. Inspired by the tribe.
Yeah.
Discount. Yeah.
I love
We're
it.
all about saving people money.
Yeah, learn lots.
Okay, my win. I'm super stoked. A couple of months ago, as I mentioned, that I had won a corporate culture award on behalf of my organization. I'm really, really excited to say that I was asked on behalf of my VP and my organization to go to Toronto in April to attend the Most Admired Corporate Culture Gala event. And there's going to be a whole bunch of us that are going to go and accept the award on behalf of our organization. And I'm one of those people.
Sweet.
That's amazing.
Yeah.
That's
Good
amazing.
job, Angie.
Thank you.
Good job.
So that means we can say we have an award-winning writer in the house?
You sure can. Award-winning communications and culture specialist in the house.
Wow.
Fancy.
Thank you. I'm really excited because it's a really cool networking event. It's also, I think I said previously that I'm not good with small talk, but there's a summit there, which is a leadership component. And anytime the word leadership is involved with a conference or schooling, I'm all there because it's about bettering yourself and it's about learning how to make other people better. So that's what I'm super stoked about. So,
Angie, I think you should show up in a crown that says Queen of Culture because you really are the Queen of Culture.
Thank you. You know what? I think we've all collectively spoken about this. There's just so much darkness in the world right now. There's a lot of anger. I don't get it. And we're in the hope and positivity business. So we're just going to keep shedding love and light to all of you. And I hope that we can turn this around. That's our premise.
Well said.
Yeah.
Cool.
Thank you. So I'm really, really, really excited about today's topic. I'm sure you two are.
Yes.
And this is one of the reasons why we have Shiv, we have you in the house today, because everybody is doing this right now. I want you to talk to us about what's going on, what's trendy, what's happening, because today's episode is all about cosmetic injectables, PRP. And so we're going to be unveiling the fountain of youth today.
Yeah.
Okay, Shiv, let's just get right in there. They're called cosmetic injectables. What are they? And let's get into with PRP afterwards. So
Sure.
what is it? Why is it called cosmetic injectables?
So cosmetic injectables are neuromodulators, better known as Botox. So what it does, it prevents the contraction of the muscles, which form lines and wrinkles.
So that's what neuromodulator stands for.
That's what neuromodulators are. So basically, it deactivates the movement of the muscle. So if I could, I would show you my wrinkles, but I'm fully Botoxed up here. So right across my forehead, in my 11s, and around my eyes. So the old Shiv had like these almost 1 inch crease across, like laterally from my eye here. Wrinkles across my forehead, and I was starting to develop a line up here. So the Botox, what it does, it deactivates that movement.
Okay.
Now I can still move like up and down my eyebrows, but I don't get any of the other lines that were happening up here.
Okay.
So the lines that are on like upon movement are called dynamic lines. So when somebody makes that expression, you will get the lines that'll show up. Then what happens over years and years of the repetitive motion of the muscle, they become static lines. So static lines are at rest. So you'll see individuals that, had not got Botox, for, their entire life. And then they'll come and they'll have these lines right across the forehead. To prevent that from happening is to get the Botox.
Okay.
And how long does a Botox last if someone injects those lines?
The recommendation from the manufacturer is about 3 months. So 3 to 4-ish months. So, and some people it does last longer. It just depends on the individual. Depends on environment, heat, exercise, metabolism. The more active you are, you will burn it off a little bit faster.
Oh, the more active you are, the more you'll burn it off. Not the more active you are, it'll stay longer in you. Oh, interesting.
No,
Okay.
because your metabolism's a lot faster than the average person. Summertime, it wears off faster because of the heat.
You're sweating it out.
Oh, okay.
Because of the heat. And then in the winter, it does last a little bit longer in theory.
So question, because there's just so much, I think, negativity around Botox. There's always people like, oh, they hide it. They don't want to talk about it. It's just like a taboo. Why is there such a taboo around Botox? Like, is it really that bad for you or is it not bad for you?
No, it's the business of vanity, right?
Okay.
So if you look at it in that sense, just like how mental health, people don't talk about mental health, right? It's one of those taboo subjects.
Right.
Same with cosmetics. I'll have individuals come in and I really do reinforce the fact that this is completely confidential. Like I will not tell your sister, your mother, your husband, don't matter. Like I'm not telling the soul, and if I do post any pictures, it's fully consented. Okay. So I think that's the personal stigma that individuals may have. And
to elaborate, because I feel like that comes a lot from men than women. I think you and I had spoken about this off camera, that a lot of women don't want their partners, their spouses to know.
Yeah.
Can you maybe share a story or something similar of like, people coming in and having to do this, I guess, behind their partner's back or?
Oh, it happens all the time.
Wow.
Yeah. Ladies will bring in cash, right? So it doesn't show up on the credit card or the Interact machine.
And their partners don't notice that their forehead doesn't move anymore?
No, but Botox is very subtle, right? Come on, we're guys, right? A lot of the guys don't notice hair change or
That's true.
Or something else, right? So like something's different. But again, Botox is not so like drastic and dramatic. It's a gradually it starts to work, right? So after like days to 2 weeks is a peak. So you'll still be able to move your forehead when you leave the clinic. You'll have the little bumps. They'll dissipate after about 15 minutes, but it's nothing like filler. If you get your lips filled, like someone, most likely will notice.
So maybe that's the confusion that a lot of viewers and people that don't have this, that Botox is, like you said, no one will really notice, where fillers you will notice when you get that done.
Yeah.
Okay.
Also, depending on the amount of filler one gets, location, and the volume, right? So you can get treatments that are very subtle. And some individuals want the subtlety. Some people like, I want to walk out like I got filler.
Okay.
And what is the difference between filler and Botox?
Yeah.
So filler restores volume. So as we age, we lose our skin elasticity, we lose our bone mass, we lose muscle, and we lose fat, right? All in our face. And then they say, oh, gravity. It's not gravity. It's a loss of all of those combined. So then the filler restores the volume. So think of it like, you've got our cheeks go down, or, even areas of the jaw and all the muscles up here. So we're basically restoring the volume. So for the women, we do more laterally, we do the cheeks, right? To kind of give that V shape again, right? For men, we inject different areas to give more masculine, like make them more squared, like do the jaws more and whatnot. So the filler is to restore lost volume, and the Botox is to prevent the formation of lines and wrinkles.
What is the filler made of that you're putting inside your body?
Hyaluronic acid.
Okay, so that's what your body produces, right?
Your body naturally produces it, and over time, we basically start producing less and less of it. So we're restoring that, and it's like think of it as, so it's called cross-linked. So what that means is, if you look at it like a window screen, right? So it's like layers of screens that basically form like a matrix, right? Okay. So what that does is, with a structure, the one that's more tighter and firmer gives you more, we inject more deeper to give you like basically adding bone again, right? So then you can use softer ones that are not more pliable for the lips. So if you're kissing somebody, they're not going to know that you're not going to have like lumps and bumps in your, in your lips. So the formulation is different for different depths of where you're going to be.
For the fillers. For the Botox, it's like a one-stop shop.
It's one, yeah.
Okay.
I mean, there are different classifications of it. There's therapeutic and then there's cosmetic.
Okay.
So the ones that I do primarily is cosmetic. So for the therapeutic one is for hyperhidrosis, excessive sweating. So under the arms, palms.
So it's not just cosmetic Botox. It can be, therapeutic.
There's also therapeutic as well. For migraines, for overactive bladder. There's tons of indications for it. Yeah.
Okay. I have a question for you. Why is it called filler? How did that term come to be?
You're restoring lost volume.
So you're like
filling back up again.
You're filling areas that are deficit.
Oh, okay. That makes sense. And the other question I have for you, are there different types of filler? How many different types of fillers are on the market? Can they all be injected? Do they all serve a different purpose on the face? What are they like? How do they work?
So there's a lot of companies out there that provide filler. I use Teoxin or Teoseal. That's my filler of choice. There's the Stellage. There's so many other ones.
Juvederm, I've heard of that, yeah.
People have heard of. It really depends on the price point.
Okay.
Let's be honest about it, because it's not cheap.
Okay.
And then the other thing is that the injector's preference, right? What are they comfortable injecting?
And why do you choose that specific brand?
It's got. I have an amazing support from the sales rep. They do on-site teaching if I need to learn a different technique. There's the price point is also good, though it's not. Though there are ones that are cheaper than this one, but it's a filler that I haven't had a filler myself. I'm actually going to get under my eyes done, and that's a product I'm going to be using.
Now that you said under your eye, you're going to get fillers put under your eye, and what will that do for you?
So just restore the lost volume. So if you look at my face here, right, if the viewers want to see here, so as I've gotten older, you'll see a little bit of the deficit under my eyes here, right? So what I'll do is we'll put one type of filler here to support my cheek structure. So create like a scaffold or a support structure. And then we put a softer filler under the eyes to basically restore that lost volume. So it'll look like I took an amazing nap and look refreshed.
And how long will this last for?
12 to 18 months.
Oh, wow. So much longer than Botox.
Even longer.
Oh, okay.
Even under the eyes, it can last even 2 years.
Wow.
And are there any risks for getting it done underneath your eyes?
Yeah. So funny story you asked is that I actually did PRP on my mom. And so she was going, so this was on a Saturday. She was going to her friend's 70th birthday party on a Tuesday. So everything went fine. We did the PRP. I put a little pilot hole here, put the cannula underneath, little tube, injected it, all good. Next day, she had a shiner. Huge black eye.
Oh, boy.
Yeah.
So you did not inject her with the filler. You injected her with PRP.
With PRP.
Okay, can you...
Which we'll explain that. But let him finish that story. We'll explain that.
Yeah.
Okay.
So, sorry, say that again.
Okay, we'll get to PRP afterwards.
Yeah, so explain, carry on your story.
Yes.
What happened to your mom's black eye?
Yeah, so then you have to just ride it out.
Oh, you never do things like...
But how long does that take to actually go away then when that happens? About a week?
Yeah, about a week or so.
Okay.
Yeah, I had a shiner when I did PRP too. It was pretty cool. I felt
Is it because of that location and where it went into?
Yeah, I mean, if somebody was to actually look at the blood vessels of the face, the fact that people do not bruise more than they do, it's shocking because, I mean, I should be hitting more blood vessels, right? Like, I mean, the veins, not the arteries, the veins, right? And the fact that people don't bruise, but I also use finer needles as well.
Okay.
There is that risk, obviously, of.
Is there, before we move on to PRP, is there anything else that we haven't asked that we should know about fillers or Botox? Like if our viewers, maybe thinking about people who come to see you and the questions they ask, something that we haven't thought to ask you.
Is there too much you can get, like too much filler, too much Botox, and what are the side effects of that?
Yeah, so too much of the Botox is you're going to get paralysis of muscles that you don't want. So you can get drooping of the eyelids. You can get, if it's done incorrectly for the muscles around the face, you can get like a drop in your smile. It can affect your smile, even your cheeks. So it's very, very precise for the Botox that we do. Filler, can you get too much? Yeah, you can have too much where you can cause actually necrosis of the tissue. So it stretches so much that the blood vessels collapse and can cause death of that. Of the tissue. But the one thing I do want to say is that individuals are so quick to get filler, like, mostly women.
Mm-hmm.
They don't understand that the risk of filler is far more than Botox, even though Botox has it's a toxin, right?
Mm-hmm.
So, but the complications of filler are far more worse than Botox.
Wow.
And how is Botox a toxin if we're putting it in your body to help with restoration of like lines and wrinkles? And
it stops a receptor of basically the muscle from moving, right? So that's all it is. And it's temporary and it stays localized.
But when you say toxin, then it's actually not bad for the body. You're just saying it's bad for those cells because that's what it's doing to that area.
Yeah, it's basically stopping a receptor.
I see. Okay, so it's still safe for the body. That's why it's being
safe
injected.
for the body.
Okay.
Yeah, it's safe for the body. Yeah.
Okay.
Though the title says toxin in it.
Botulism. Yeah.
Okay.
Okay.
Yeah, botulism toxin.
Yeah.
Oh, they call it that. Okay.
Yeah.
I didn't know that.
Yeah.
I have a question to ask you. I've often seen this, and there's that term, the puffy face, when people get a really puffy face. I get a puffy face when I eat too much sugar.
Yeah.
And I was going to ask you about, this is going off topic, but what is it about sugar that causes inflammation? But when I don't eat sugar, I find that my face is more slender and slim. But I've noticed there's that term when people is there such a thing as too much Botox, too much filler, where they have that puffy face look?
Yeah. So individuals that have had, good question, individuals that have had so much filler over and over, they'll get like this kind of round face, right? Where it looks like it's puffy. If it, it's like very swollen looking, right? It stops looking natural. So what those individuals actually should be getting is getting it dissolved with hyaluronidase, dissolve it all and restart again from that.
Oh, how do you dissolve? Like, you put a dissolver in someone's face?
Yeah, so it's a liquid. It's called hyaluronidase. Again, prescription from a pharmacy that I order. And I would, like, if anybody had lips done, I could dissolve the lips, dissolve the cheeks, jaw, wherever.
So you can reverse it pretty much.
So everything is reversible then?
Yes. So the other thing for the hyaluronidase, you have to have it on site when you're injecting, right? The reason is if you cause a vascular occlusion. So meaning that if you inject it and it goes into your artery, you are going to basically cause death of the tissue that's past the area of where the blockage has occurred, right? So most common places are if people do filler over here, which is more devastating, can cause blindness, can cause stroke.
Oh, wow.
So that's why I don't fill in this area ever. The other area is around the mouth. You can get necrosis, tissue death around the nose area. And in the lips is around the lip area. So if somebody has excruciating pain upon injecting, you have to have that antidote there to immediately start just injecting like crazy to make sure that I reverse that and to not cause any further permanent damage.
Oh, wow.
Wow.
And can anybody go and do this? Or are there people who, like you said earlier about treatments, like, is there something that people can't get this done if they are on some medications or if they're on things? Is there?
Yeah, usually blood thinners, right? Blood thinners are the main thing. Anybody with like autoimmune problems, because think of filler as a injectable implant, right?
Oh.
So you're putting a foreign body in your body.
Okay.
Right? Mm-hmm. Your immune system, if you have a compromised immune system, it's going to attack that filler. Mm-hmm. So you have a higher chance of getting infections, higher chance of getting abscesses. So individuals like that, I would never inject, or they should be going to somebody that's perhaps more like, that has clearance from them or from a specialist. Or if they've had filler and they've had no problems, then I would be more inclined to inject them.
Okay.
What's an abscess? What does that mean?
It's an infected collection of basically fluid where it shouldn't be.
It's like pus, right?
Yeah, basically it's like where it collects underneath the skin and it forms like a little pocket.
Oh, wow.
Yeah, that's gross. I've seen videos of that when they pop it. It's like yellowish, greenish.
Yeah. Oh, it could be.
Boy.
It could be from like liquid to like thick. It looks like cottage cheese being squeezed out of the skin.
Oh, wow.
Like it's gross.
Okay, so how does someone find a good injector? What are the types of questions that if someone is interested in getting Botox or a cosmetic injectable, what kinds of questions should they be asking if they're shopping for an injector?
Yeah, great question.
So far I've asked some really good questions. Thank you very much.
Yeah. But just, just drill them with questions like, how many have you done? You know, what are complications? What product do you use? How much do you use?
Okay.
You know, like what are the risks? What are potential risks that can happen? I have a lot of individuals that are apprehensive, right? So they'll book a consultation. I'll sit with them. I spend more time educating my clients than I do actually injecting. Injecting is quick. It's easy. I have the knowledge to do it. I have the emergency, the reversal to do all that. But it's to provide your client the support and educate them, right? So that they can make an informed decision. Is this right for me or not?
Right.
Mm-hmm. Okay. How many of your consultations, if you don't mind me asking, convert into actual transactions that day?
Conversion rate's super high.
Wow. Is it?
Yeah. Well, usually if they book a consultation, they're getting injected.
Really?
Yeah.
So they don't walk away?
Usually not.
Oh, that's amazing.
And is your clients 50% men, 50% women? What's the ratio of your clients?
No, it's predominantly women.
Okay.
Yeah, it's predominantly. But I mean, there's more and more men that are getting, yeah.
And what do men come in to get?
Usually Botox.
Botox. And where are they getting this Botox?
Forehead, around the eyes, same spot I do mine.
Okay.
I've had one individual did get his lips done.
So, wow.
Yeah.
A man.
Yeah, a man, yeah.
You heard it here first on this podcast.
Yeah.
There we go.
Well, you never know, right? Sometimes people had like surgery or something happen with
Yeah,
to fill it in, and they'll just actually fill it and make it look normal.
But he wanted aesthetically, he wanted his lips to look a little more voluminous.
Oh, okay.
Wow.
Yeah. And then I've done jawline. Excuse me. I've done jawline as well.
Maybe he's in show
Jawline, what does
business.
that mean?
Yeah.
It's just to make it more prominent. So creates a little bit more separation from the face and the neck. If you go like this, like it'll be all like one.
Okay.
It just creates a more of a separation, more definition of it on the jawline.
Wow. And that's using Botox or
No, filler.
Filler. Okay, to create that look. Okay.
Yeah.
Okay. I've got
Let's
a
go on to
question.
PRP.
Yeah,
my
before we
favorite.
get to PRP, can you debunk any myth about Botox being bad? Preventative versus non-preventative.
I think it's a great product. I mean, I like it. I think that the only misconception that I already touched upon was that the filler is a lot more dangerous as a treatment. Botox is temporary. It's localized. It stays in the area that you treat. I can't say that I've had any reactions with the Botox.
Okay. Good to know. Now, before we move on to PRP, I'm excited about this because Rose and I have had PRP treatments.
I love it.
I have done in the past laser genesis. I have done micro needling. I've done facials. I have done all the natural things that you can think of to prevent my skin from going or they're trying to prevent and slow down the aging process. I'm going to throw this out there and say this, that I think hands down PRP is the most underrated treatment that nobody knows about.
Yeah.
True?
Agree. 100%.
Yeah. Okay. What does PRP stand for?
So PRP is platelet-rich plasma. And the process is very simple. I draw your blood and I have a centrifuge, a machine that basically spins the blood like a laboratory would. And it's got a separator in there. So it's like a tube with a separator. With the force, it forces all the red blood cells to go past the separator. And then at the top, you get what's called liquid gold, right? Mm-hmm. So liquid gold is your plasma with your platelets. And it looks like gold. It's the yellowy color. And that is then taken, divided into my syringes, and then is injected into the areas that you guys have done yours. Mm-hmm. So it's for like hair regrowth for individuals that have had, have thinning hair, post hair transplant, or just need some nutrition for the scalp. Also, it's got growth factor in there, and it stimulates collagen production naturally. Because as we age, the collagen production also goes down.
Right. Okay.
So you can treat basically like facial rejuvenation under the eyes, for acne, for scarring, for just plumping of the lips. You can do it, but it's a multi-step process. So, you kind of get the perk of it that day. It kind of subsides. Your body has an inflammatory reaction, starts producing more collagen as a byproduct. But usually it's every 4 to 6 weeks, 3 treatments. And then after that is as needed, one or 2 a year.
1 or 2
Okay,
years.
and that's how long this it'll last for. And is that because collagen is producing into your skin over that time, and that's why it lasts longer?
That's a theory behind it. Yeah.
Okay.
So some individuals might require, 6 sessions, or it's very, very dependent. Okay. So individuals like you guys, you're young, you're healthy, you started taking care of your health at an early age, which is amazing. The hardest people are like my mom, right? Are the individuals that come to you and are in their 70s, and it's like, make me look young. Make me look like Angie. Or make me look like Rose.
Make me show ready.
I'm like, it's not going to happen.
Okay, now you were mentioning that you had PRP'd your mom under the eyes and she got the shiner. So where can PRP be done? Can it be done anywhere all over the body? And how did you PRP her eye area? Yeah,
so scalp, basically anywhere on the body you can do it for, right? There's some areas, obviously, like, again, this is in its infancy. There's talking about, PRPing for G-spots for women.
Wow.
You can do, so you can do also for erectile dysfunction. There's some doctors that do PRP for there. It's only growing, right? So my specialty, I don't do any of that stuff. I just focus on the face primarily. So, but it's for like anywhere from the neck, rejuvenating any parts of the skin. So normally, aesthetically, people focus on their face.
And just so the viewers understand, like PRP, like you said, it's taking your own blood from your body. Essentially, like I want to say it and simplify, it's cleaning out all the toxins out of the machine and then putting it right back into your body. So it's like fresh blood again, right?
Yeah, exactly. And then the beauty of PRP, differing from filler, is that your body will produce its own collagen and its own matrix again, but there's no chance of getting a reaction. Right. The only adverse event that might happen is like I give my mom a black eye.
Me too. Remember, I had a little bit of a shiner. I messaged him. I'm like, I feel like I was in a boxing ring. I feel really cool right now.
Yeah.
But Rose likes it when she gets bruised and stuff because
I'm weird. I like it. I feel like I'm tough.
She knows it's working for her.
Yeah. I feel like I'm like, did you see my shiner? It's like I got punched in the face.
Rose wants a black eye. She wants the pain. Yeah. If it's not painful, it's not working.
Yeah. And I don't want the bruising or the black eye, but I know that when I had done PRP, the next day I was so puffy. And I said to you, Shiv, oh my God, I have a puffy face. And you said, no, Ange, right now it's just because I put the fresh blood, just give it a week until it settles down. And you were right.
And I'm the opposite. I call him like, my face looks really fluffy. I'm really happy.
Yeah.
She was Dewey number 2.
Yeah.
I loved it. I had the treatment done under my eyes. And I have some acne scars on my face because I used to have acne. I used to pop them. So he's gone and localized and done them on those spots there. And I have seen a big difference in my skin. I'm a big fan of this PRP. And again, anything that you can naturally do, before you have to kind of go towards the fillers and the Botox route, I'm all for that. And I've been very happy with my PRP treatments.
Yeah. And PRP, you're harnessing the power of your own body for skin rejuvenation.
100%.
Right?
100%.
That's amazing.
So, sorry, Ange, why do people not go for this and then jump to Botox and fillers? Because that would be my last thing. I would prefer to do it naturally. So why don't people go for PRP first?
Because they want instant results.
It's faster.
Oh.
Right? So filler, you're getting the result. It's like a drive-through, right?
Oh, I see.
You're getting that cheeseburger right away.
Okay.
Yeah. Piping hot, right?
Yeah. Right.
Yeah.
So, and then you got to eat it right there. Like you're good to go.
Yeah.
The PRP is a process. Like I said, it's multiple. You can think of it. It's could be more expensive as well, but I think for as a longevity and someone that's younger, do the PRP.
Right. Mm-hmm. Yeah. And he's right. Cause I've had 3 treatments done and I would say that I definitely noticed a bigger difference by the 3rd treatment. So you're right. Yeah. It does take maybe a little longer to see the results versus the drive-through. Okay. That makes sense.
So I have a question for both of you since you've been my clients.
Mm-hmm. Yeah.
Tell me or let me know, like, how was the overall procedure? Was it painful? What worked for you? What didn't work for you? What did you like? Like pain, like numbing cream, ice. What did you guys have any strategies? Or
Rose, you want to go first?
Yeah, I would say the only part that I felt a little painful was the obviously initial taking the blood out, but that's anywhere time you go even to the lab to get blood taken out. It's a little few seconds. But when you start putting my face, I don't really feel a lot of pain. I think the only time I had is because I had that kind of hole here and you kind of poked at that was a little painful. But when it goes under your eye, you'll start feeling this bubbling. It's so cool and weird. You're like, what's bubbling underneath? But I have a very high threshold for pain. So I might not be the best person to ask the question. Strategy wise, I think it was great. I would not need to numb myself, but I would say maybe she's a better person because she doesn't have the same threshold as I do.
I like to say that I have a really good threshold of pain for life, but not with needles. I get the heebie-jeebies. I get diarrhea or something starts happening to me. I get heart palpitations. Like I think I'm going to die. So hence why I'm not I get nervous about this. So when Shiv was mentioning PRP a while ago, I was like, I've had laser genesis and micro needling, like surface stuff. And he's like, needles freak me out. So you've done as I've gotten older now, I've noticed, and I like to say that I've taken care of my skin since I was 18, 19. Yeah. So I like to still think for my age that I still think I've been aging well, but you did what is this area called?
Nasolabial folds.
Right. You did like my V. I call it the V area here. Yeah. I think I didn't need to do my eyes or anything like that, but you focus primarily on here for me. Yeah. And for me, I probably should have taken the numbing cream, but I didn't. I was trying to never compete with anyone. Stay in your lane. Because this one didn't get it, Rose. And I was like, oh yeah, I can take it like a champ too. But I had Shiv ice me, then inject me, ice and then inject me. I was like, Jesus, hallelujah. Like Jesus, take the wheel, because for me, it was painful. And now I've realized that I'm not going to, and she tricks me into getting it the same day with her. And then she shows off. And then I want to up the ante, like, oh yeah, I can do it. And then I end up rolling around on the floor like, oh God, why did I do
this is
that?
Oscar winning performance she puts on for pain.
I don't do well with needles.
If Angie was not my friend, I'd fire her.
Everything about it, because it's just, I've been late to the game. I know a lot of people have done Botox and the fillers and stuff. I'm not going to lie. I've had my forehead Botox. You did it for me. Five units you did?
Yeah, small amount.
Yeah. And you said to me that I don't have those 11 lines because you said everybody's bone facial structure is different. So you said to me that I'll never get those lines.
Yeah. So that's a very good point actually you brought up, because everyone's facial structure and anatomy and the way their muscles lie is very different. So if somebody says to you, this is a standard what I do, that's a bunch of garbage, because each plan, when you're mapping someone's face out, should be very personalized for that individual. They should be looking at, where's the movement of the eye? What are you wanting at the end? Like, what are your goals at the end? So it shouldn't be you walk in there, okay, we're going to do this or we're going to do that. It should be a decision that's made together from the injector and also from the client as well.
Mm-hmm. And Shiv, to add to that, maybe let our viewers know, because it's not just cosmetic, it's also therapeutic, right? People get this done for scar tissue or some issues that they have in their knees. I was reading about that. Do you want to explain a little bit more? Yeah.
Yeah. So for athletes as well, for like joints, they'll do injections for PRP there as well. That's not something that I do. Mm-hmm. Normally, I'd say if somebody wants to get that done, I would go to like an orthopedic surgeon or a sports medicine doctor to get that done. And I think that the matrix of those PRP is a little bit structured a little bit different to yield more platelets in that. Mm-hmm. But I'm not 100% sure.
Yeah, I had PRP done on my scalp, and I was supposed to follow up on it, but because it was so painful, I haven't gone back yet. It gave me probably a headache for about 2 to 3 days, and I felt the pain overall for about a week or so.
Did you numb?
No, because he said it's not safe to use numbing cream on the scalp.
Okay. So that's the thing. Number one, Al's got very thick hair.
Okay.
And for me to put the numbing cream, I could do local lidocaine injections, right? But the thing is that if I put cream in there and I can't wipe it all off, I'm increasing the chance of infection. Okay. Remember, your skin is your largest organ and it's your most important organ for fighting or keeping you protected from the outside world. Mm-hmm. So if I'm poking a bunch of needles in them, I'm breaking the barrier.
Oh, okay.
Yeah, but I know that you said it was the first treatment. You did a bigger vial, so it would be a little bit less on the next one. But yeah, I'm gonna follow up on that. But I think when I start it up again, I'll try to do it consistently for like 3 months.
Mm-hmm. Yeah, but I also have like hair peptides we can also do as well. Okay, where we just micro stamp it. Then I also have this cocktail that I got from one of my friends for a prescription peptide. So you just put it on your scalp.
Okay. I want to
so you can do that as well.
Is that now called mesotherapy?
Yeah.
Okay.
So the peptides are mesotherapy. Okay. So that's basically it's lab kind of cocktails that you make. There's a lot of varieties for hair, for acne, for hyperpigmentation, for basically complexion. Then there's like hyaluronic acid one as well. That's not the cross-link like filler. It just provides more, basically like a better, like dewy kind of like good glow to the. Like,
so mesotherapy, any relation to miso soup?
Yeah. No.
You never know. You have to ask.
Another question I have for you is, I know initially when I started, for me, I had a little bit of lines on the sides here. I didn't get those, static lines?
Yeah.
Or I didn't have, or dynamic lines. I'm not sure, but I just had noticed on the corner here. And I think that we've got good family genes, because my grandmother barely had any lines. My dad barely has any lines. So I never got those forehead lines, but I had noticed it on the corner. So originally when I was shopping around, and this is at the time that you were obtaining your license and getting your business together. And you said, "And just go somewhere." And I was really reluctant. And I remember someone quoting me 30 units or something like that. And I was like, for one line here and one line. And I didn't do it at the time. I said, forget it. I'm just going to keep doing laser genesis. Yeah. And when you initially treated me, you just said you did 5 lines for me. And you said 5
units.
And 5 units, I should say, not 5 lines, 5 units. And so where does that go with someone that doesn't know about this, and you're going to get upsold? Like somebody might only need 10 units or 5 units. How do you gauge how many units somebody needs when they come to see you, and you're not overselling or underselling them?
You know what? It really depends on the practitioner that's doing your injections, right? Some are they're money driven, right? Because it is a business. But I think that there's some injectors that they lose the vision of that. If you overtreat them for the short-term gain of making more money, you're going to lose them as a customer. Right. So for example, like I do your forehead, right? And I say, okay, Al, like you need 35 units and you have a drop in your eyebrow, or you're like, oh, it feels heavy. You're less likely to come back to me.
Yeah. You're right.
So versus I say to you, hey, Al, come in, you're Botox naive, right? That's what I label my clients as. And I've never injected you before. Let's go on the safer side. And if in 2 weeks you feel like you need more, you come back for refinement. Right. And then the 2-week difference is not going to really make a difference in the whole grand scheme of the 3-4 months. Then you come back, say, okay, look, dude, you hit it on point. It's perfect. Or, I need a little bit more. And then that way you're not overdoing it. And you're building that relationship with the client.
Yeah, that makes sense. You'd rather start with less than.
Of course.
You can always add more, but you can't go back.
Of course. Right. Yeah. So same thing, my philosophy with lips or anything. Look, if you are naive to it, let's start slow. I don't want you to walk out being like, oh, what the heck did I just do? I look funny, or I don't feel good on my skin.
You don't want the deer in the headlights look like that.
Yeah. Or be like, oh my God, I got to go home now.
Yeah, I do know that. I mean, I don't know if 5 units is enough to do this, but for me, I used to in the past frequently suffer from migraines. Yeah. And since I've been doing, I don't know what the spots that you've done, but just those 5 units itself, man, my migraines have the frequency and the intensity of my migraines are less
yeah. Frequent. So that's a good point, actually. Chemically, the Botox therapeutic and cosmetic is the exact same. Oh. It's the labeling. So how it's labeled and how it's approved by our health insurance that'll cover it for whatever indications. So the cosmetic is obviously not covered as cosmetic. Nobody needs Botox, right? But individuals that have the hyperhidrosis or the migraines, it could be approved for that.
Okay. Well, thank you so much. We're about to.
I was very informative.
We're going to start closing it off, but I got one question for you, and I want to know your POV, which is your point of view on this. Should people just age naturally and just forget all this stuff?
I'm going to say it depends on the person. And if you want to, everyone wants to look good, right? So if you want to look good, if that makes you feel good, there's nothing wrong with that, right? I mean, I don't dye my beard, right? So I like that, but I don't want lines on my forehead, right? So I address that part. So everyone's different.
Yeah,
right.
That makes sense. Each to their own.
Each their own. That's why I don't like when people judge people do it. As long as you're not hurting anybody and it's not hurting, do what you got to do to make you happy.
And the other thing, I think the another big point is, don't compare yourself to others. Right. Because you are going to set yourself up for disappointment. That's it.
Yeah.
That's right. Like stay in your lane.
Stay in your lane.
Yeah. And just be happy with what you have. Optimize with what can be optimized is optimize that. Right. But don't compare to others.
I agree.
Yeah. And I think the one why Botox has a bad name is because for me, myself, whenever I see people, their face just looks strange or something looks off. And they always say that's what happens when you get too much Botox. And you've seen those people. And I think that's why there's like a negative connotation to it. People say, oh, you got Botox done. But I think if you have someone like how your perspective where they're saying, no, let's start up with less. You don't need all that. Then maybe people actually will have more of a natural look to and get rid of their lines without having it become swollen.
Yeah. But, go to an experienced clinician or a person that's done a lot of it and answer your question that you feel comfortable, right? And not just that you're there and, okay, this is do it now, right? So, and Hollywood makes fun of it. If you remember that part of Christmas of the Cranks, he had Botox done and he's walking around. So that part is like, you look at it, you're like, who wants to get that done?
Right. Who wants to look surprised?
Yeah. But the thing is that, so they, obviously that's their business. They make fun of that stuff, right? But, can anybody tell that I've had Botox done?
Right.
It looks pretty on point for me.
Yeah, I think it's great.
Your eyebrows are sitting in the right spot. People are getting done too much, like right up there, and you're like, whoa. It's like,
I think you're right, Shiv. What you said is there has to be that balance, right? The whole idea of these cosmetic, PRP, and Botox is to, just help with the features, to enhance your features, not to make yourself look like someone that you don't look like.
Exactly.
It's to harness your own beauty, right?
I can't have somebody like, I want to look like Kim Kardashian at the end of the day. You have to be realistic with what you want. You want to, enhance your cheeks or your lips. That's an attainable goal. Absolutely. But if somebody comes in, but they don't have that, they got the thin lips and they want to walk out looking like Kim Kardashian's lips, that ain't going to happen. It could maybe over time, we layer it, we work on it, but it's, you have to be realistic. And I tell clients that, look, I can't do that.
Right. Although, Shiv, I have seen your IG page at Micro Medical Artistry. You have taken someone's lip and transformed it where it almost looked like one of the Kardashians. So you have done that. You are capable of doing that. So if any of our listeners and our viewers want to be able to check you out, the work that you do, the services and the treatment plans that you offer, where can they find you?
Yeah, Micro Medical Artistry.
And that's on IG,
Instagram, and Facebook as well.
Okay.
And I'm working on TikTok and just got to find more time.
Right. Okay, perfect. Well, we want to thank you so much for your time. Thank you for coming in studio and once again educating us on cosmetic injectables, PRP, Botox, and just everything about what's happening right now in the world of the beauty standards.
Well, the fountain of youth.
Thank you to the
Thank you.
You're welcome. So to our listeners and our viewers, hope today was a insightful episode going into the world of and unveiling the fountain of youth and what you can do to continue taking care of yourself if any of these things interest you. If I can ask you to hit that subscribe, like, and share button if there's anything that you liked in today's content. And once again, if you're interested in getting any of these treatments and you live in the Lower Mainland here in Vancouver, British Columbia, check out Shiv Sidhu at Micro Medical Artistry. Give him a shout out. He has offered to give any of you a special family discount rate. So please take advantage of that and send us your DMs of what worked for you and what didn't. Think about your win of the week. The tribe is going to be back next week. And please take care of yourself until then. Bye for now.
Bye-bye.